Approximately 23,000 patients in the U.S. die each year from antibiotic-resistant infections. Jim O'Neill, head chair of a British study, said, if left unchecked, then worldwide it could be 10 million deaths per year. This equates to more deaths than cancer and diabetes combined. It is the second leading cause of death worldwide and third in the United States. Hi, I'm Jessica Pillsbury, and I've read a slew of web articles, listened to many TED Talks and NPR podcasts, along with interviewing my personal doctor, Deanna Spade. I've compiled all the information that I have learned during my research on this global public health challenge that we are confronted with. The overprescription of antibiotics will cause antibiotic resistance, thus causing superbugs to form, which are detrimental to you and your family's health. I believe if we continue on this path of abusing the antibiotics that we currently have, we will be in a post-antibiotic world. First, I'm going to tell you about the history and how resistance has affected our ability to fight off infections. Then, we will discuss the overprescription and widespread effects that it has had. Finally, I will tell you some different ways on how to stop the spread of germs and probable solutions to help stop this growing epidemic. To begin, I will tell you about the history and growing resistance to antibiotics. The first antibiotic discovered was penicillin in 1928 by Alexander Fleming. This revolutionized the practice of medicine. In the 1930s, the first commercially produced antibacterial drug was a sulfonamide called Prompicil. At first, supplies were limited and priority was given to the military until 1945, whenever it became available to consumers at the corner pharmacy. Today, 30% of the antibiotics that are prescribed are unnecessary. They are being prescribed for respiratory conditions caused by viruses such as the common cold, viral sore throats, bronchitis, and sinus and ear infections, all to which they have been proven not to help with at all. This has led to an increase in microbial resistance, cause of severe infections and longer hospital stays, resulting in an increased healthcare costs and surge in mortality rates. MRSA was first seen in the 1960s. It is spread from skin-to-skin contact and is the #1 cause of skin infections and infections within the hospital settings. MRSA kills more Americans every year than emphysema, HIV, AIDS, Parkinson's, and homicide all combined, according to the Infectious Disease Society of America, or IDSA. Tuberculosis, gonorrhea, typhoid fever, group B streptococcus, C. diff, UTIs, and E. coli are all examples of resistant bacteria that we face on a daily basis. Without antibiotics, ventilators, catheters, ports, kidney dialysis, surgeries, and burn victims would all be susceptible to infections that could kill them. When Fleming was accepting his Nobel Prize in Medicine in 1945, he said, "It is not difficult to make microbes resistant to penicillin in the laboratory by exposing them to concentrations not sufficient to kill them. There is the danger that the ignorant man may easily underdose himself, and by exposing his microbes to non-lethal quantities of the drug, make them resistant." His prediction was correct. Penicillin-resistant staph emerged in 1940. Tetracycline was introduced in 1950 and showed resistance in 59. Erythromycin was brought in 53, started showing resistance in 68. Methicillin was brought around in 1960, showed resistance in 62. Levofloxacin was brought in 96 and showed resistance that same exact year. Linezolid was brought around in 2000, showed resistance in 2001. And finally, daptomycin was introduced in 2003 and shortly after in 2004 started showing resistance. As soon as antibiotics were discovered, they were also immediately feared that they would be abused. If we continue on this path of abusing the antibiotics that we currently have, we will be living in a post-antibiotic world to where the smallest scrape could once again lead to infection and ultimately death. Now, let's see how widespread this is and look at some demographics on it. Antimicrobial resistance, or AMR, is the greatest threat to human health worldwide. It doesn't just happen to poor, developing countries. It can happen to anyone, anywhere. It doesn't matter if you're old, young, healthy, or sick. It can and will happen to anybody. The modern travel of people, animal, and goods has also helped spread microbial resistance across countries and borders worldwide. The resistance that we are facing could eliminate advancements that we have made in healthcare over the last 100 years. It is estimated that 2 million people in the U.S. alone develop drug-resistant infections every single year. And more than 70% of those cases are resistant to at least one common antibiotic that we use. This leads to more than 162,044 deaths every year. The prescription of antibiotics is influenced by many factors, including cultural aspects, socioculture and socioeconomic factors, and the cultural beliefs of the patient and prescriber both. While interviewing my doctor, Deanna Spate, she said, the number one reason for prescribing an antibiotic is that the patient or parent pushes for one, even when they've been told that it will not help. But they feel that they need something before leaving the office empty-handed. Tom Frieden, director of the CDC, says, losing our antibiotics would undermine our ability to treat patients with deadly infections, cancer, and our ability to provide organ transplants and save victims of burns and trauma. In the 1940s and 50s, Thomas Jukes discovered that when you give antibiotics to livestock, it will help them grow bigger and prevent diseases. Within 5 years, American farmers were given their livestock 500,000 pounds of antibiotics every single year. Today, it is more than 34 million pounds of antibiotics given to livestock every single year. U.S. meat animals consume 4 times the amount of antibiotics that people do. This has contributed to our growing epidemic of antibiotic resistance. 1 in 5 resistant infections are caused by germs from food and animals. It moves from animals to humans by means of groundwater, dust, flies, and via the meat that those animals are turned into. Out of all the antibiotics sold within the U.S., 80% by weight are used in agriculture. As diverse as humans are, we are nothing compared to the adaptability that microbes have. They can inhabit any possible climate and environment on this planet, including extreme boiling, freezing temperatures, extreme salinity, zero oxygen, and with the presence or absence of sunlight. Because of their diversity of habitats, microbes comprise 60% of the biomass on the planet, despite their submicron size. They are the most numerous, diverse, and adaptable organism to ever live on Earth. Us humans, we're just walking microbial planets. We have 5 to 10 times more microbes on and in us than there are human cells in our body. Bacteria take 20 to 30 minutes to replicate, and humans take 20 to 30 years. In 2011, there was a superbug called KPC that had an outbreak at the National Institute of Health Hospital in Bethesda, Maryland. 19-year-old Troy Stalin from Wilmer, Minnesota, was there getting a bone marrow transplant. He went home months later, and he was healing and recovering from it, and one day he woke up with blisters all over his body. His parents were concerned that due to his compromised immune system that he might get an infection. So they took him back to the hospital. What they thought would be days turned into months. His condition was only getting worse. In August of 2012, Troy tested positive for the KPC, 8 months after the hospital thought that it had been contained. At first, he was given a strong antibiotic called colistin, and it seemed to be working. But the infection mutated, and the colistin was no longer effective. His vitals began to fail. So I ask you, how can you be at the best hospital in the country and them not be able to help your child? How can you be at the National Institute of Health hospital and they have no answers for you on how to help treat your child and cure him? In September 7th of 2012, his family gathered around him in the ICU. He passed away later that evening. Troy was the last known victim of the KPC outbreak. We have shown resistance that has significantly increased throughout the world due to the adaptability of microbes and the increased use in agriculture. So, what can we do to help solve this problem? Well, some causes of resistance include the overprescribing of antibiotics, patients not taking their antibiotics as prescribed, the unnecessary use in agriculture, poor infection control in the hospitals, poor hygiene and sanitation, and also the lack of rapid lab tests. The best way to stop the spread of germs and prevent staph infections is to simply wash your hands with soap and water. We've heard this a lot lately with the coronavirus going out. Stop the spread of germs by washing your hands with soap and water. If you don't have that available, then you can use an alcohol-based hand sanitizer. You can clean and cover your cuts and scrapes until they're healed, and avoid contact with wounds and bandages of other people. Also, avoid sharing personal items such as toothbrushes, razors, and towels. The opioid epidemic in this country adds further urgency to our crisis. The CDC reports people who inject drugs are 16 times more likely to develop an invasive MRSA infection. The cost of treating resistant infections in the U.S. healthcare system is an astonishing estimated $21 to $34 billion annually. In 1980, there were 25 big drug companies who were devoting serious time and money to the development of new antibiotics. Today, there's only 3. 3 big companies that are devoting time to the development of antibiotics are Pfizer, GlaxoSmithKline, and Merck. The process from discovery to medicine takes approximately 10 years. The average cost to bring one single antibiotic to market is over $1 billion. Under the current reimbursement rate, it would take a company 20 years to break even. The consequences of failure to create new antibiotics would be catastrophic for the human race. Justin O'Grady has developed a nanopore metagenomics called the MinION. It rapidly and accurately characterizes bacteria and contributes to the reduction in broad-spectrum antibiotic use. With faster diagnostic testing with only 6 hours from sample to result and very high success rates. As of now, until lab results come in, it's an educated guess onto which antibiotic to give the person. Usually, they are prescribed a broad-spectrum antibiotic, which in turn doesn't target the one thing it needs to, it targets all of them, and therefore kills some of the good stuff that's in there instead of the one bad thing that it needs. When diagnosing patients, doctors should use general terminology rather than medical terminology. This will make patients less inclined to need a prescription. And we also need regulations that are new for use in the agriculture. To wrap up my speech, I believe if we stop abusing the antibiotics that we have, we will be able to once again fight off infectious diseases successfully. Since the discovery of antibiotics in 1928, we increasingly have abused them, which prompted superbugs to form. This eventually will cause us to be pan-resistant, meaning that we will be responsive to no antibiotics at all, making modern medicine a thing of the past. The only viable long-term solution that we can do is to have in place a continuous, steady development of new antibiotics. And since it takes years to develop, planning must include immediate needs that we need now and also those anticipated to occur over the coming decade. Sir Alexander Fleming said, "The thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbs to infection with a penicillin-resistant organism." Now, I have a few fun facts for you about germs. Germs can survive 3 hours on your hands. There are between 2 to 10 million bacteria on your fingertips and your elbows. The number of germs on your fingertips doubles after you use the toilet. When you do not wash your hands, you transfer germs to the food and drink that you eat. Hands spread 1,000 times more germs when damp than when they are dry. One single germ can multiply to more than 8 million germs in one day. Nearly 80% of illness-causing germs are spread, you guessed it, right by your hands. Remote control is a top carrier of bacteria. There are more germs on your phone, keyboard, and cutting board than there are on the toilet seat. That's a lot. 1 in 5 do not wash their hands, and those that do, only 30% of those people use soap. Also, did you know when you sneeze, you shoot droplets with up to 100,000 bacteria and viruses into the air at 100 miles per hour. And those droplets can stay in the air for up to 10 minutes. So, I'm asking all of y'all to please do your part to stop the spread of germs and wash your hands. Thank you.